Batch Tree? Did I say that right? Well, tell me how to say it. Bayou Bayou La Batterie. That's in Alabama, people. Bayou La Batterie is a rural town of about 2,500 people. It's a shrimping town where a lot of folks work for themselves, scrape by, and can't usually afford health insurance. And by the way, Dr. Benjamin, while we were talking in the Oval Office, described for me the demographics of this town are actually very interesting because you've got whites, blacks, and Asians in this community. There are a lot of Laotians and Cambodians who have moved there and are part of this shrimping town. So it's a diverse but very poor rural community. And like so many other rural communities, doctors and hospitals are hard to come by. And that's why, even though she could have left the state to make more money as a specialist or as a doctor in a wealthier community, Regina Benjamin returned to Alabama and opened a small clinic in Bayou La Batterie. When people couldn't pay, she didn't charge them. When the clinic wasn't making money, she didn't take a salary for herself. When Hurricane George destroyed the clinic in 1998, she made house calls to all her patients while it was rebuilt. When Hurricane Katrina destroyed it again and left most of her town homeless, she mortgaged her house and maxed out her credit cards to rebuild that clinic for a second time. She tended to those who had been wounded in the storm, and when folks needed medicine, she asked the pharmacist to send the bill her way. And when Regina's clinic was about to open for the third time, and a fire burned it to the ground before it could serve the first patient, well, you can guess what Dr. Benjamin did. With help from her community, she is rebuilding it again. One disabled patient brought her an envelope with $20 inside. Another elderly man said simply, "Maybe I can help. I got a hammer." For nearly 2 decades, Dr. Regina Benjamin has seen in a very personal way what is broken about our healthcare system. She's seen an increasing number of patients who've had health insurance their entire lives suddenly lose it because they lost their jobs or because it's simply become too expensive. She's been a relentless promoter of prevention and wellness programs, having treated too many costly and diseases and complications that didn't have to happen. And she's witnessed the shortage of primary care physicians in the rural and underserved areas where she works. But for all that she's seen and all the tremendous obstacles that she has overcome, Regina Benjamin also represents what's best about healthcare in America. Doctors and nurses who give and care and sacrifice for the sake of their patients, those Americans who would do anything to heal a fellow citizen. Through floods and fires and severe want, Regina Benjamin has refused to give up. Her patients have refused to give up. And when we were talking in the Oval Office, she said, "The one thing I want to do is make sure that this Surgeon General's office gives voice to patients, that patients have a seat at the table. Somebody's advocating for them and speaking for them." And now we in Washington and across America have to refuse to give up on the goal of health care that is affordable and accessible for every last one of us. We don't have to deal with hurricanes, and we don't have to deal with floods, and we don't have to deal with fires. All we have to do is pass a bill to make sure that the American people have a decent shot at getting the kind of choice and high-quality health care that's affordable. And I know that Dr. Benjamin is going to help us get there as the next Surgeon General, and I'm truly honored to nominate her for that post, and Secretary Sebelius is equally excited, even though she's just standing here. With that, let me introduce the next Surgeon General of the United States, Dr. Regina Benjamin.
Thank you.
It's kind of hot out here.
It is. Thank you, Mr. President, and thank you, Secretary Sebelius, for being here with me. I am honored and I am humbled to be nominated to serve as the United States Surgeon General. This is a physician's dream, but for me, it's more than just a job. Public health issues are very personal to me. My father died with diabetes and hypertension. My older brother and only sibling died at age 44 of HIV-related illness. My mother died of lung cancer because as a young girl, She wanted to smoke just like her twin brother could. My Uncle Buddy, my mother's twin, who's one of the few surviving Black World War II prisoners of war, is at home right now on oxygen, struggling for each breath because of the years of smoking. My family's not here with me today, at least not in person, because of preventable diseases. While I can't, or I cannot, change my family's past, I can be a voice in the movement to improve our nation's health care and our nation's health for the future. These are trying times in the healthcare field, and as a nation, we have reached a sobering realization. Our healthcare system simply cannot continue on the path that we're on. Millions of Americans can't afford health insurance, or they don't have the basic health services available where they live.